Welcome to Your Health. I'm your host, Rhonda Alfred, and joining us on this episode is Dr. Nathan Sutton, a hospitalist at Terrebonne General Health System. Today we will discuss how Terrebonne General was recently named as the top 10% in the nation in patient safety, specifically for pneumonia and sepsis outcomes by CareChex. So, welcome to the show, Dr. Sutton.
Hey, Rhonda, thanks for having me.
All right, well, today we're going to talk a little bit more about our outcomes in two very important areas. But first, tell us a little bit more about yourself and your role at Terrebonne General.
Definitely. So I am the medical director of the hospital medicine program here at Terrebonne General, and the hospitalist role is a fairly new role here at Terrebonne General. It was started back in 2019, and basically what it's able to do is give us a presence in the hospital with 24-hour physician and nurse practitioner support here at Terrebonne.
Okay, very, very valuable. And so let's get started about CareChex. What are the CareChex Award, and why is TGMC being recognized?
So it's basically a CareChex is a recognition and award based on patient satisfaction and quality outcomes. So we're getting an award based on us being in the top 10% of the nation.
All right, and how many organizations were reviewed?
So every hospital and healthcare system is reviewed in the United States.
Okay, so that's out of
Right. Yeah.
everyone in the United
Yeah.
States.
Definitely.
That says a lot about Terrebonne General. So walk us through the pneumonia and sepsis protocols for prevention.
Yeah. So basically, when you first come into the hospital, everybody is evaluated initially. We're triaged. We're seen by a nurse and then a physician or a nurse practitioner or PA at that point. So vital signs are assessed, laboratory values are assessed, and based on those criteria, we're able to delineate: could this patient be septic, or is this patient not septic? And as sepsis is such a big mortality risk. It's one of the biggest mortality risks in the hospital. It's important to identify those patients very quickly, and then we can delineate how we treat them thereafter.
Okay. And with sepsis and pneumonia, do you recommend getting the pneumonia vaccine?
Absolutely. So, the pneumococcal vaccine is approved for ages 65 and up, or much younger with comorbidities such as diabetes, heart disease, COPD, risk factors such as that.
Okay. And what are the measures that have been taken to achieve this award?
Yeah, so some of the measures that have been taken, I think the hospitalist group does a good job because we're here 24/7.
Mhm.
Our sepsis coordinator is a huge role that we have here at Terrebonne General that's able to identify patient charts and come to us immediately with those concerning patients that, that someone may have missed or that we haven't quite seen yet. So I think that's a big deal. The other thing is that our EMR is really good at alerting us to those septic patients as well. And then, like I talked about previously, you've got so many people that are seeing the patients, from the emergency department to the hospitalist group to other providers in the hospital. And once we're able to delineate those septic patients, we've got a pretty standardized set of measures that we're able to achieve. So we start drawing certain blood tests, we start blood cultures, we get all these things that are pretty standardized, and then start to administer antibiotics, get certain imaging, and then not only that, but then we're able to track those parameters through time to see how we're doing with the septic patient, and if we're making some improvements, are they deteriorating, and we need to change course. We're able to measure these things in real time and react in real time.
Right. That's important. And so it's all about the outcomes, correct?
Absolutely.
Okay. And the significance of this award to the patients in our community.
Yeah, well, I think it shows that we can deliver high quality healthcare close to home. So I'm sure that's reassuring to our community.
Okay. And how else do you see Terrebonne General taking preventative measures?
I think one of the biggest things is our PCPs in the community. We've got some great primary care physicians and some great primary care providers here in the community at Terrebonne General and Homa in general, and then our new clinic out in Gray that we've got as well. So I think those are all real important factors.
Right. And you all collaborate
Yeah,
together along with the
absolutely. Yeah,
specialists.
definitely.
All right, good. Well, tell us a little bit more about the hospitalist role. It's just so important.
Yeah, definitely. So I think it's important because it allows that 24-hour presence, and that's something that we haven't necessarily had until 2019 when we started that role. The hospitalist model is something that's been around since the mid 90s, but it's really in bigger cities and on the West Coast. So it's really slowly trickling down. To more rural communities and past, getting a little away from the West Coast. So one of the main things about that is that we're here and able to provide care in-house 24/7. So, when my shift is over at 7 p.m., another physician is coming on at 7 p.m. with a nurse practitioner. So we've got coverage 24/7.
Right, a very progressive way to treat patients.
Definitely. We're here. We're available for the nursing staff. We're available for rapid responses, code situations, and all those things.
All right. So, what do you think is the most important takeaway you'd like our viewers to know today?
I think that the most important takeaway would be that, like I said, we're providing high quality healthcare here in the community, and we're collaborating with your primary care providers, and we're happy to take care of you.
All right. Well, thank you, Dr. Sutton.
Yeah, definitely.
Appreciate
Thanks.
you being here.
Absolutely.
For more information about Terrebonne General's preventive health measures, please visit tghealthsystem.com. I'm your host, Rhonda Alford. Thanks so much for joining us on To Your Health, and I'll see you right back here next week.